Hello, everybody. Dr. Lonnie Stewart here from the Healthcare Education Transformation Podcast. Are you a physical therapy student about to start studying for the National Physical Therapy Examination? Or maybe you're a professor, a program director, or clinical instructor who teaches DPT students preparing for the NPTE? Either way, we would recommend checking out our sponsor, NPTE Final Frontier, and the community they've built around preparing for and succeeding on the NPTE. That exam and the preparation that goes along with it can be long, tedious, difficult, and stress-inducing, but it doesn't have to be. NPTE Final Frontier has the tactics and resources to help address all of the usual barriers. They even have scholarships to help with NPTE study courses, FSBPT registration fees, and even research opportunities. And if that's not enough, they're even donating to the very first annual HET Podcast Scholarship to be awarded at the end of every year. Go to npteff.com for all of the details and use code HET for 10% off all purchases. Links to both the NPTE Final Frontier and their scholarship options are available in the show notes. And now, let's get ready to learn.
Hello, everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm your host, Dr. F. Scott Field, and I've got with me tonight two very special guests, newly minted Dr. Brooke Pantano, and soon-to-be Dr. Carolina Marrero Rodriguez. Ladies, thank you so much for joining us. We're going to talk tonight a little bit about the student perspective on leadership, because these two young ladies have done some amazing stuff. Totally blew me away with their leadership and their roles they took and what they've done so far. I cannot wait to see where their journey goes. But let's just start off with this. Brooke, why don't you tell us a little bit about your academic journey and how it's led you to where you are today?
So I guess, we'll start off. I always kind of knew that I wanted to be in healthcare. I'm the first person in my family to go to college. I'm a first gen. And so that process was a little different, but my mom always encouraged me to chase my dreams. So she was like, go do it. But I ended up taking me to the University of Pittsburgh. I'm originally from the Philly area. And part of the reason I went to Pitt was because I knew they had a good PT program, and they also had a major in rehabilitation science. So I was like, that sounds exactly up my alley, and I want to do that. And I loved it. And I ended up staying in Pittsburgh for grad school. And I was at Pitt's PT program. When I was still an undergrad, I did some work as a tech. So I worked for a couple different PT companies, mainly in outpatient. I also shadowed. And then I did a really cool study abroad opportunity in Ireland where I got to shadow in a lot of different facilities like special education schools, hospitals, with other like rehab majors. So it was very interdisciplinary, it was a really enlightening experience, and really happy that I did it. And yeah, and that kind of is what led me to going to PT. I guess I originally decided to pursue PT because my mom has a genetic neuromuscular disease called Charcot-Marie-Tooth. So that was kind of what led me to the profession. And then I kept with it, and then I ended up here.
Here you are. Well, Carolina, how about you? What was your journey like going through academics and now getting ready to graduate?
So when I was in sixth grade, we had a career day. And I think I've just always been fascinated with the musculoskeletal system and how it works and that it moves and it makes us makes us be capable of doing what we do every day. And that kind of just stuck with me from the time I was like 10 or 11 years old, all the way up through high school. I thought about, oh, maybe I'll be a vet, maybe I'll be a psychologist, but I always went back to PT. So I ended up going to Arcadia University right outside Philly for undergrad because they had a sports psychology major. And I was like, I don't want to be a bio major. Everyone's a bio or exercise phys major for PT school. And I'm just not good at that. I want to spend 4 years studying something I really like. Plus, for sports psychology, I was required a year abroad. So I did a year abroad in Scotland where I studied sports studies and linguistics. The linguistics part was part of my Spanish minor.
Nice.
Came back, finished out undergrad, took a gap year just because I didn't feel like I was ready to go right into PT school. So I took a year off. I worked at a clinic in my hometown that specializes in manual therapy. I was very, very lucky to have a boss that really valued education. So I learned a lot while I was there. Applied to PT schools, decided to go to Pitt, found my way into the APTA, met a whole bunch of people, got a whole bunch of different perspectives. Now I'm finishing up my last clinical and figuring out what I'm going to do.
Man, time flies. Like, it's crazy that you guys are now working and about to graduate. Like it honestly, I felt like at CSM, like when I first got to meet some of you guys, it was like you just seemed like little tiny PT students. And now you're all grown up and you're out of the nest and you're flopping your wings. I love it. So let's talk a little bit about the meat and potatoes of tonight's episode, leadership, especially from a student perspective. What on earth caused you guys to pursue a leadership role as a student? I know how tough it is to be a student. I know how hard it is just to get through PT school, let alone one of the best PT schools in the nation. It's a tough program. And you want to do more on top of that? You want to go above and beyond and be a leader? What drove you to do that? What caused you to pursue that?
When I was still an undergrad, I did not pursue a lot of leadership roles. Part of that was that like I worked a lot in undergrad and I just didn't feel like I had like the time, or I don't think I like really had the confidence to pursue leadership roles. Like I got done, I was involved in a lot, but I didn't really grasp too much at leadership roles. So when I got into grad school, I was like, all right, like I knew full heartedly I wanted to be in this profession. I had like followed a lot of people on social media and I was like, I'm so passionate. And I came in kind of guns blazing. So I was like, I am ready. And I remember like first semester, like we had class leadership that we were running for. And one, I knew I didn't really want to take like president or anything like that, but there was like an APTA rep position. And I was like, ooh, I want that. That was kind of, I was like, okay, this is a way to kind of dip my toes into like the professional side, of this profession that I'm now, about to be a part of, am a part of as a student. And I was really excited to see like how I could get involved because I felt like, having worked in clinics and kind of being immersed, I was like, I know that there's so much we can do in this profession, but I know there's also like a lot of, there's a lot of issues where we're battling with our profession. I wanted to be able to kind of get going with that. So that is kind of what motivated me to get started. And I think like a lot of people, like I said, I came in like ready to go. I was like so ready to start school and like so ready to be a PT that I was like, any way I can get involved, I wanted to. And that was kind of how my journey started. And from there, I was lucky enough to connect with some previous board members on social media. And they were like, yeah, like, here are some roles that you could potentially like go for, like just like, put an application and see where it takes you. And that's what I did. And that's kind of how I ended up here. But it all started with just like having a deep passion for this profession, wanting to help make it better.
Yeah, you were ready to go from the get. You were just like, "Hey, bring it on. I'm ready."
Maybe too much.
Yeah, right. But that's a good thing though. I mean, you went from like, didn't really do much leadership to like, no, if I'm gonna do this, I'm doing it right, all in. And Carolina, I got to meet you at the APTA's ALI LAMP leadership course, which is an amazing course. I strongly recommend anybody go and take it. But you were one of the few students there, which I was also blown away by. Like, that's awesome. A, that you had the opportunity to do that, and B, that like, I mean, you took it full on. Like you were just like, let's do this LAMP leadership. I'm in there with new grads and people that have been in the industry for years. And, some people obviously like some of our teachers for that course, CEOs of hospitals now at this point, so like just some wild people in that group doing amazing things. How did you get started in leadership? How, what got you started and going?
Similar to Brooke, I was very, very involved in things in high school. I got to undergrad and I went to a very small liberal arts school. I think I had a hard time getting my footing, like finding exactly where I wanted to fit into things. So I didn't really get involved on campus a lot. And then studying abroad for a whole year took me away. And then I came back and was just worried about writing my thesis. So I had my gap year, COVID happened. I had a lot of time to like self-reflect. Being stuck at home gives us that. And I was thinking a lot like, yeah, okay, I want to be a PT, but I don't want to be just a PT. I want to do more. Like, what can I do to be that little bit extra to help our patients, to help the profession? And one of the first things I did was look into medical interpreter training, which I ended up doing over COVID. It was great, something I definitely recommend for people that do speak a second language. And I came into PT school just like Brooke, ready to dive headfirst into whatever was offered. And Brooke was actually one of my first I would call Brooke a mentor. I would say, because she's one of the first people that I talked to about getting involved in my first semester as well, because I wanted to run to be the APTA rep for my class, and Brooke was the rep for her class. So I was like, hey, I want to do this. How does this work? I want to get involved, all this stuff. And I think a lot of students that get involved in the APTA can agree with me on this, that once you get your foot in the door, it's like you're rolling down a hill, because it doesn't stop. The opportunities don't stop. The people you meet don't stop. All of a sudden, you can do 5 million different things, and you take a whole bunch of things onto your plate and you realize, wait, this is way too much. I need to really narrow it down, focus on what I really want to do. And eventually I got a scholarship to attend the ALI LAMP course. I realized that I don't need to find my niche now in a specialty. I can find it in leadership, which is something that I'm really passionate about. And one of the reasons why I wanted to get involved in leadership is because I want to help people communicate better. I want to help facilitate better group dynamics to meet a common goal. I feel like I might be getting ahead of the conversation a little bit, but that's one
That's
of
all
the
right. We'll get
reasons
there.
why, yeah, one of the reasons why I started pursuing everything. I want to help. I want to help people be better. I want to help things work better, because if we can work better together as people, we can achieve our goals faster, easier, less problems, less hassle, achieve even more than our goals if we want.
Yeah.
So.
Well, I love your guys' story, first off. Like, Brooke, thank you for being a mentor and for giving back and bringing in the next generation to do the leadership thing. But, like, A, you both got to study abroad, which is nuts. Like, that's amazing. But B, like, you both kind of wanted to do the APTA leadership thing, and you stepped up and you both had that. What was that experience like? You know, tell us about being in, like, the APTA leadership realm as a student.
Yeah, so I know like I was saying previously, I had followed a lot of people on social media. So I had followed a lot of like previous board members, and I remember one of them being Yusra and the DBT Diaries, and I was like,
Mm-hmm.
wow, this is like super cool. These people are like helping to like make content like for these conferences and like for these small things and for these student socials, and like they're really engaged with other students. And I just thought it was really cool like how involved they were already with the profession as students and like how wide of an audience they were reaching. So I was like really just amazed of how people were like how they were able to like grasp such a wide audience. Um so I think at first I was a little intimidated to be like, oh, like this is like a national organization. But I think once you get immersed into it's like everything you think it's going to be, and then you realize it's everything it's not. I think it's one of those things where you're like, okay, like this is a national organization. There's so much I can do and there's so much I can't do. So I think that is kind of what I first realized. The first role I had in the APTA was as a member of the Advocacy Project Committee. So every year, the student board will kind of, well, the board itself will kind of delegate whether they needed extra project committees to, you know, facilitate certain goals on what they're working on that year. So that year, which I believe was 2020, was when they were having that. So I had at that point worked like with the president a little bit, the previous student board president, and our whole goal was to kind of communicate with different states and to see how we could help them to pursue advocacy and get more students involved with advocacy through like dinners and planning different things. And it was that then when I realized like, wow, there's all these roles, but I think there's a lot of people that like might not know how to do their roles, or we're realizing there's a lot of unfilled roles. And that's kind of when I realized, okay, like there's so much potential here, but it can be so hard, especially on like a state by state level, to facilitate all of this. Cause I remember like I had some states I was working with that were like, yeah, like we have all this stuff planned. Other states were like, we don't have anyone to fill this spot. And we've never done anything like this before. And I was like, wow, okay. And then after doing a little bit of that, I ended up pursuing the role on the student board. Having done some like state work, I was like, okay, like I want to reach like the widest audience. So that means like being on the national board. And it was interesting because the year that this past year that we ran for, that was the first year that they were allowing students to campaign. So it felt very like real, I guess,
Yeah.
because we had to like make little posters and infographics and be like, this is what I'm running for. But it's one of those things where it's been a really incredible experience because I've got to connect with other students that are like equally as passionate about different topics. Everyone has their own strengths. Like we all have our weaknesses and we know how to kind of, you know, help each other out and facilitate off of those. But also like you realize in doing that, like how much the organization is doing that like people don't realize, and also like how much we could be doing but like are limited by bylaws or limited by all the things that govern national organizations, things like you never think about. So that's what's been, I think, the most eye-opening is like you realize like everyone's here like trying to facilitate a common goal, but there's so many things that get in that way, and like how can we actually move forward and make change. So
yeah, for you to grab that perspective this early on in your career is awesome, because it's true. It is a big national organization. It is very slow moving. There is a lot of politics and red tape. And at the end of the day, everybody is trying to help. They're trying their best to like do the thing they can to help steer the ship in the right direction. And sometimes it means turning the ship, but it's a big ship, so it takes forever, right? And I think one of the, the biggest issues, like you said, is like there's so much that can be done and so much opportunity, but then you're also kind of handcuffed at times as well. And so you have to kind of give and take a little. But the big takeaway I got from that is that if you're going to bitch and moan and complain about it, you got to be on the inside to make a change. You have to like do something about it and take an active role. I personally have a whole lot of issues with the APTA, and yet I've been a member for 20 years now, because I know it's the right thing to do. They're the only group backing us up, and I get it. I'm not happy with a lot of things going on there, so I keep running for positions and I keep losing for positions, and that's okay. At least I'm trying to get in there and make a difference and a change. So I applaud you for that. Carolina, what was your experience like? What did you gather from it?
I think one of the first things I realized as I was getting involved was that physical therapy is a very, very small world. And basically everyone knows each other.
Yeah, all 300,000
when,
of us,
yeah, it's
it
insane.
feels
There's so
way
many of
smaller
us,
though.
yet
Yeah.
so little. Right. It's crazy. My first semester, my anatomy professor got me in contact with Gustavo, who was a previous board member, I think a year or two before Brooke and I. And he started a group for Spanish speaking physical therapists, which is why I got put in contact with him. But I reached out to him saying, hey, I want to go to CSM. I'm a first year PT student. I don't know what to do. What am I doing? Please help me. We talked, and then he was like, I think he'd be a great person to get really involved. You should talk to Teo, who was that year the nominating committee chair. So he got me in contact with Teo, and I talked to him and was like, yeah, this is what I'm interested in, blah, blah, blah. I don't know what I'm doing. And he said, yeah, we should meet up in Texas and definitely talk, and like, I'll introduce you to some people. I go there and I'm with one of our geriatric residents. She went to one of the student events with me. And I found out she had been on the board the previous year with Gustavo and Teo. And then we all went out for dinner, and it was just like super insane. It was surreal because all these people know each other. And I know them from very different ways. And long story short, I also ended up going to Leadership Congress that year, which was really cool because I had no idea what it was or what I was doing. I was a student observer to the APTA House of Delegates. So I got the opportunity to go to Leadership Congress, go to the student development program, where I got to meet even more students that know each other in different ways. And I had known some of them from different ways and had met some of them in CSM and met some of them on social media also. I decided I'm going to run. I'm going to go for it. I'm in a 2-year program. It's now or never. I want to keep meeting people. I want to keep talking to people and helping them pursue whatever they want to pursue and make it easier for them and share what I have to share so that they can do what they want to do. So I ran and I met a lot of really cool people. I think one of the really unique things about running for positions like this is meeting all of the people running. And even though some didn't get elected, we still talk to those people. There were like, everyone was such a great candidate, and even though they weren't elected, they still went on to do some really awesome things, and we still stay in contact and are like, hey, I want to bounce an idea off you, or hey, I'm in the area, let's meet up, let's do this. And it's just a really awesome and unique culture. Fast forward again to the next CSM in California, I got a scholarship to attend the LAMP Leadership Conference, where I really started to reflect on myself and who I am and what I do, what I want to do, how that affects others. what can I do for others, and all that stuff, which was a lot as a second year student. It was a lot. It was great, but it was a lot. And on top of that, being in a position where I'm on a national student board, there's a lot of people who know who I am, but I don't know who they are. And talking to them and realizing how much of an impact I can have on people, which is crazy. And I think although that was a really difficult time mentally to just get a grasp on all of that, it really helped me realize why I want to pursue leadership and why it is important for me. Everything chilled out since then, which is really nice. And I'm just
Yeah.
trying to navigate the transition from being a student that's really involved to being a young professional that's really involved, and trying to figure out where it is that I want to make that difference. Because I have experience in the house, I have experience with the board of directors, I have experience in a few academies, but I can't just pursue every single thing,
Right.
or else I wouldn't have time to be a PT, which is the point. But
Right. And now for a quick shout out to our newest sponsor, Varela Financial. If you're a physical therapist and you have student loan debt, you got to talk to these guys. What makes them unique is that they view financial planning like running hurdles on a track. And for PTs, the first hurdle many of us run into is student loan debt. Varela Financial will help you get over that hurdle. They not only take the time to explain to you which plans you individually qualify for and how those plans work, but they also take the time to show you what your individual case looks like, mapped out within each option. So if you're looking for help on your student loan debt or any area of personal finances, we recommend working with them. I use Varela Financial personally, and they were able to help me lower my student loan repayment from about $1,800 a month down to about $135 per month, simply by finding the right repayment plan that best fit me, my family, and our life goals. You can check them out at varelafinancial.com. Link is in the show notes if you need it for reference, and tell them the HET podcast crew sent you. And now, back to the show. I had a mentor of mine, he was a business mentor, and he said, saying yes to everything will get you out of Egypt, but saying no to the right things will lead you to the promised land. And what he meant by that is you really do, like early on in your career, you're going to say yes to everything. You're a go-getter. You're trying to experience things. All these opportunities are coming your way. So you just keep saying yes to everything, right? And you didn't get this far in life without being a high achiever, right? So you just keep thinking, I can keep saying yes and yes and yes to all this stuff, and I'll just keep doing all the things. But eventually you have to find that North Star so that you can pursue it and continue to pursue it. And then that helps you ask the question with every opportunity that comes to you, is this going to propel me towards the North Star or pull me away from the North Star? And if it's going to lead me away or astray, it's a no. If it's going to lead me toward it and help propel me toward my North Star, then it's a hell yes, right? So that is, again, great that you guys are learning this stuff so early in your career, because I didn't learn it until it was like way into my career. And I was like, what am I doing? I'm going to burn myself out if I keep doing all these things. Like, I need to just focus and stay on my passion and what drives me. So I appreciate and applaud the fact that you guys are getting so much good information so early on in your career and doing some amazing things with it. So congrats, continue with that. Please don't stop. Why should students consider getting into leadership roles as students? Like, what would you say to students that are kind of thinking about it? Why should they get involved?
It's never too late to start, as this is never too early to start. Like, there's never a bad time to get involved. Like, I know I was nervous about getting involved with things because I was like, have I not done enough before? Like, because I didn't do leadership roles like in undergrad, like, is getting involved here, or I haven't been like a president of a club before, like, is this not enough? But there's, what I have learned is like, you do not have to be completely qualified, because you will get there. And if you're passionate and you care, you can fulfill that role. But just because you haven't done XYZ does not mean you can't go for it. And regardless, like what Carolina was saying, like, I met in our like experience running for positions, I met so many incredible people who didn't end up getting slated, who are doing awesome things or ended up filling another role. And that doesn't make them any less of a leader because they didn't get picked. There's never a bad time to just go out there. Like, if there's anything I've learned, it's that like I should put myself out there. And if I get rejected, I get rejected. But the more I put myself out there, the more I know I'm going to continue to grow. So I think that's the biggest thing. And there's no, like, it's never too late to start your leadership journey. And, you know, if leadership is something you want to pursue, there isn't one, you know, specific set of boxes for a leader. There's a lot of different leadership styles. Everyone is a different type of leader. Like, I think how I, like, my leadership skills differ from Carolina's leadership skills, and how we approach things, although I do think we have similarities. But, you know, it's very intimidating to think about. But, and I know now, like, in my journey in school, like, I think I was good at saying no to things. Believe it or not, I got good at that. But I think I got really good at being like, okay, this serves me. I'm gonna, like, maybe not do this, but focus on these things. But I was still doing a lot. And now, like, transitioning into, like, a clinician and no longer being a student, but still being in being part of a student role, that's been tough, because now I'm like, okay, like, I'm at my full-time job, but I'm trying to figure out, like, now that I work full-time and I'm no longer a student, like, how am I transforming into a different leadership role? So it's been an interesting journey, but I think having done things as a student really put me in a good spot, because now, being a new clinician, I know these things, like, I have some experience, and not only that, but I've built, like, a really incredible network of, like, people I actually really admire. Like, I've met so many incredible people just through, like, being at CSM alone. And even, like, my experience being at CSM the first time I went, before I was really involved in the APTA, and the second time I went, and it wasn't
night and
even,
day.
yeah, night and day. And it wasn't even as much, part of it was like, yes, like, because I was in this role, I was able to then be put in these rooms with these people, but also my confidence through the roof. Like, I felt like I could actually network. Beforehand, I was so scared. I was like, I don't know how to talk to people. Like, I can't just go up to people. And I was just, like, going up to people like, hey, I'm Brooke. Like,
Yeah.
let's chat. Like, oh, or my favorite is like, hey, I know you from Twitter.
Yep.
And I think we follow each other, and I think I've commented on your stuff. And
Yep.
I think that might have been how, F. Scott, I feel like we might have, that's might how be how we went about it.
I'm sure.
Yeah.
Yeah, most of my student crew comes from Twitter usually. When you know, finally get to meet up at conferences and stuff. So I don't know why PT World loves Twitter so much, but they
And
do. They love to fight and argue and bicker on there all day. So
do.
I don't know.
As much as they love to bicker, they love to network too. That
Yes.
would be my other thing, is utilize
Yeah.
social media to as a
Yes.
way to get to know people, because that's literally how I think I've built so much of my network outside of just being involved in the APTA. It's like putting my voice out there on Twitter, and, like, finding the very small world of PT within Twitter, who everybody knows each other apparently. And then I meet at my conferences, and then it's like, wow. And it's really facilitated such great friendships and also mentorships for me. And now, like, it's helped me so much as I've started my career, and now I'm trying to transition my leadership role in a different state, and in a different part of my journey now, like, as a clinician.
That's awesome. Yeah. Carolina, what would you say when it comes to why students should get involved in leadership and why they should pursue this thing?
I'm gonna be really annoying here and say, why not?
Yeah, I like it.
I feel like, we learn about motivational interviewing, and, I've been really on it with this clinical rotation. I'm in workers' comp. There's a lot of, I would say, socio-psychological
Yeah.
barriers. Like, I ask my patients why not a lot. And I realize I ask everyone why not a lot. Why not get involved? Why not try this out? It's $80 a year to be a member as a student. And even from a financial standpoint, I try to tell people I pay $80 a year and I have gotten so many things out of it. I went to Leadership Congress twice for free. I went to San Diego for a week for free. On top of that, I've met so many people that have given me so many opportunities. I've learned about different parts of PT that I didn't know existed. I remember attending my first Adrian Lau lecture about pain and neuroscience and just having my mind blown. Like, it's not all about the leadership and the positions either. It's about the education that is offered to you by getting involved. It's about even finding your own place in involvement. Like, you don't have to have a leadership position. You don't have to be involved nationally if you don't want to. You can be involved at the state level. You can be involved in sports only if that's your thing. You can advocate in government affairs if that's your thing. With so many avenues, why not do it? You can do whatever you want.
You guys are so brilliant at such a young age. It is making me like tear up. Like I wish I was this smart at 20 years back in my career. Like it is unbelievable, just the stuff that you know and the stuff that you're doing and the opportunities that you're taking. I think that's a key word that we're taking away from this episode is just opportunities. It is amazing how many opportunities start coming your way when you step up to bat for a leadership type role. Like you guys said, like you're going to have to start turning them down and really narrowing them down because it's just like flooding your inbox all the time. Like, hey, want to do this? Hey, want to do this? Hey, I saw you on this. Hey, could you do this? Could you show me this? Hey, want to come do this? It's like, yeah, I want to do all that, but I have to start narrowing them down now. It's like your time is becoming more valuable now. So you have to really pick and choose. Well, ladies, thank you so much for coming on the show and spending your time with us to talk all things leadership from a student perspective. We have one question we ask all of our guests, and that question is, if you could change one aspect of higher education, whether it be DPT or otherwise, what aspect would you change and how would you change it?
For me, I think the biggest area is, access to higher education. I know, like, the first thing that comes to mind for me is like financial barriers to higher education, especially DPT education. In terms of how to change that, though, I mean, I am very pro let's make college more affordable.
Yeah,
I
you
know,
and me
like,
both.
yeah. I think like what's tough that I think about is like when I was in undergrad and like Pell Grant, like I was a Pell Grant kid, so I got those available to me. And luckily, like my undergrad wasn't as crazy and that was able to be done. But then grad school, like I'm over 150K in debt. And you know what? I just accepted it. And I was like, well, but then I think about other people now that students ask me, like, should I be a PT? As now that I'm like the PT on the other end. And I'm like, yeah, I love this profession so much, but like try to reduce the debt. And
Yeah.
that's what's tough. So I guess right now it's tough. I know I'm working on a project right now with a couple of people, including Jason Falvey, that we're presenting at CSM on financial strain on DPT students and new graduates. And I'm kind of presenting on the student perspective for that. And something that we're talking about is like, how can we reduce financial strain? Because there's so many things like clinicals being unpaid, but taking up months and months and months of time. And if you're a student that works or if your student needs, like, how do you facilitate that? So I know that is something we're brainstorming as how can we make sure that students are supported and how can we make this more accessible to students. But I think that financial aspect of the DPT degree, the really poor ROI that we're seeing right now, like I think that's definitely going to shade people away from the profession. And I don't want to see that because I love this profession so much and I want it to continue to grow. And I want to know how can we make this accessible. That's like my biggest thing is always like, how can we make things more accessible to everyone? And I think that's my biggest thing.
I completely agree with Brooke. Also, basically, what I was going to say, but to take a different approach, I think there's some dissonance in physical therapy programs in that we are students and our job is to be a student first and foremost, which I completely agree with. However, we're encouraged to be APTA members. We're encouraged to get involved in our communities. We're encouraged to do all of these things outside of our roles as students, which is also arguably equally as important, especially in developing into a new clinician. I've talked to a lot of students, both within the APTA, at the Pro Bono Network conference, and there's a lot of sometimes pulling teeth when it comes to getting people involved and getting people to do other things, especially when they're not required to, especially when they're worried about the next exam, when PT programs are shortening their length of their total program length to get us out faster and decrease our debt, making our semesters more packed, less time to get involved in other things. How would I fix this? I don't know. In a perfect world, we wouldn't have to worry about tuition. We wouldn't have to worry about having everything be short so we can get out in the world working sooner. We wouldn't have to worry about wow, do I stay home and study for this anatomy exam, or do I go out and volunteer at the pro bono clinic and help make a change in this person's life who can't afford care otherwise? And I feel like sometimes that's a really hard decision to make. I think I've chosen the non-academic decision more often than not. Again, the hard part about not saying no and wanting to help and wanting to get involved, I feel like that's just the nature of who we are as PTs also. But there's lots of barriers that are making it difficult for students to get involved, and part of it is the nature of PT school, how it is. How do we fix it? I don't know, but it's something that I think would greatly improve the student experience.
Yeah, I mean, it's multifactorial, right? And that's one of the issues. I think it's cost, it's access, it's time, it's, length of program, it's workload, it's, mental capacity, and like how much are you, having to actually work beyond school and learn and get the information. Is a 2-year program, accelerated program, better? Is it worse? Should you stretch it out to 4 years and let them work? Like, that's why there isn't necessarily a right or wrong answer. It just, we're trying the best we can and trying to figure out all the different options. And I don't know that we found the best one yet, but I think it's still a work in progress. Seeing a little bit more uniformity maybe across the schools would help. But I think the problem is that all the programs are succeeding in one way, shape, or form. So it's hard to say that any one is better than the other, so still working at it. We'll get there. Ladies, thank you again so much for your time and for coming on. Where can people find you and reach out to you if they want to follow up and ask more questions or get involved or just see what you're up to these days on socials and on the interwebs?
I'm pretty active on Twitter, although I will say that I've been since I've started work. I don't know.
Yeah.
Trying to figure out my life.
Yeah, that
but
happens.
yes, my Twitter is Brooke_DPT. I would say that's like my social media of choice. I do have Instagram as well. I have like a PT one that I'm a little less active on, but I do occasionally check it. And that is just, oh, that's the same one. Brooke P_DPT. And if not, we could share emails on here or something. And I'm always happy to answer an email if we want to like add that on here.
Yeah, we can put that in the show notes for sure. Carolina, where can folks find you?
On Twitter, it is currently Carolina, spelled like Carolina, like the States, ___ SPT. Although in about 2 weeks when I graduate, that will be changing to DPT or some variation if that's not available. But that's what it is right now. Same thing with my Instagram, will be changing soon, but it's currently Carolina.spt. I'm pretty active on both. I would say pretty accessible. Probably will be a little less accessible up until graduation, but I'm around.
I love it. Well, thank you, ladies, so much. It was an absolute pleasure getting to catch up with you and chat with you about things leadership involved. Best of luck in the future. I can't wait to see your journeys and how they turn out, because I know there's some big things ahead for you. So congrats and good luck.
Thank you.
Thank you.
Hello, everybody. Dr. F. Scott Field here, and we don't do this nearly enough. I wanted to thank you as an audience for being here, for listening to the shows. Without you guys, we wouldn't have anybody to geek out with over education and learning and teaching and educating. So thank you for being here, for being, faithful listeners over the years. Also, if possible, we'd love to ask a favor. We don't do this often, but if you could leave a rating and a review on Apple Podcasts or Spotify or wherever you listen to this podcast, we would greatly appreciate it. It helps boost our rankings and our algorithm, and really just helps get this message out to more people out there in healthcare education who may need, some of the episodes and the experts that we interview. So if you could, like I said, leave a rating and review, we would greatly appreciate it. And we will see you on the next show.